areas. Then the funding and resource decisions are made by the joint CCG without considering health inequalities between these disparate areas. And this is exactly what is happening in my area. Now, Telford is a post-war new town created on the East Shropshire coalfield. And the town has areas that are amongst the most deprived areas in the country. And it has, by every measure, significantly worse health outcomes than Shropshire, which, as a county, has, by almost every indicator, better health outcomes than the national average and significantly better outcomes than Telford. So we are experiencing just such a hospital reconfiguration. Telford and Shropshire are combined together, and funding for hospital care is allocated to the area as a whole. But what we have seen is a joint CCG representing these disparate areas deciding to direct the bulk of this funding and to move existing resources, to the more affluent area from an area of deprivation. And this, Mr. Chairman, is a clear failure of the duty to narrow health inequalities. Now, the NHS database has the figures there for all to see. When it comes to health outcomes, Telford and Shropshire are at different ends of the spectrum. If you live in Telford, the premature mortality rate is 25% higher than if you live in Shropshire. Children in Telford are far more likely to suffer from obesity or to be hospitalised for dental decay, and tragically, rates of suicide and cancer in Telford are significantly higher than in Shropshire. Smoking rates, inactivity in adults, and other such indicators show the very same disparity. The truth is that a shire town in rural England is healthier than a new town built on a former mining area on the East Shropshire coalfield. And NHS spending allocations are required to recognise that greater need. It's that simple. And yet in practice, this is not what is happening.